Welcome to Dr. Pam Unleashed, where we skip the gimmicks and get real about what helps pets actually thrive. I'm Dr. Pam, functional medicine vet, symptom decoder, and your guide to a vibrant, no BS pet care. Let's get into it. When a new puppy parent brings home their beautiful, furry bundle of joy, there's one conversation that always comes up: spay or neuter. Never really framed as a choice. It's an expectation. You just do it. No options laid out, no menu to choose from, just one path presented like it's the only path there is. Which, come to think of it, makes this feel like a little game show. Except real puppy parents don't even get shown all 3 doors, or even 2 for that matter. Most only ever see door 1. For years, we didn't even know we were playing a game with more than one option. Behind door number 1, the surgery that you all know about, spay or neuter, depending upon whether you've got a boy or a girl. It's standard, the expected, what everybody tells you to do and what most of us do without a second thought. Behind door number 2, leave them intact, which, if we're being honest, most people have been taught to treat it like the wrong answer, like you're a bad owner if you even asked about it. But there's door number 3, and almost nobody tells you it's there. This series, The Gland Effect, isn't just about what's behind door number 3. It's about what we're learning, and in a lot of cases, just starting to learn, about how important hormones really are, not just for reproduction, but for overall health, for disease prevention, and for your dog's whole well-being. We've had this conversation before, by the way, just in a different species. Human medicine spent decades getting the hormones wrong, first dismissing them, then fearing them, before the research finally caught up. And I can't help but wonder if we're about to learn the same lesson again, this time in the vet field. I made this decision myself for my own pets, and I didn't always get it right. But I've never really waited around for somebody to hand me the answers. I dig around through coursework, the functional medicine research, a lot of it out of the human field. And then I asked myself, I wonder how this plays out in dogs. That's how I got here, following the literature, following what I actually was seeing in my own patients year after year, until the picture became impossible to ignore. So that's the shape of this whole series. Today we're opening door number 3 all the way. I'm going to walk you through what's actually behind it for your female and for your male. I'm going to show you a study that backs up something I've been watching play out in my own patients for a few decades. And I'm going to tell you about my dog, Jet, not just because he's adorable, but because I've made this decision myself without having all the information. And I think you deserve to have it. This is Dr. Pam Unleashed. Let's get rolling. Why this wasn't a choice until suddenly it was. For most of veterinary history, spay and neuter wasn't offered as a choice. It was simply expected. You brought your puppy in and you got your dog fixed. The only owners who didn't were breeders or people who'd done enough of their own digging to push back on what they were told. For everyone else, it was never really even discussed. It was just what you did. That started to shift around 15 to 20 years ago when a handful of vets began doing ovary-sparing spays and vasectomies, what we call gonad-sparing procedures, that stop reproduction without stripping out the hormones. It's not a coincidence that this lines up with when the human medicine started taking hormones seriously as more than just reproductive plumbing. I spent those same 20 years watching this play out one patient at a time. Dogs who kept their hormones longer just seemed to hold up better, steadier weight, sturdier joints, more resilience as they aged. It wasn't a controlled study, it was just pattern after pattern, showing up in exam room after exam room, until it was really hard to call it a coincidence. Good reasons drove the old standard: population control, fewer unwanted litters, lower disease risk. Real reasons at the time, with the research that existed at the time. But good reasons for a, quote, standard, and the only option are 2 different things. That's the gap we're closing today. The evidence. Let me give you something concrete, because I don't want this to be just about my opinion. There was a study in JAVMA in 2023, led by sports medicine vet Chris Zink, that looked at over 6,000 dogs, intact, neutered, spayed, vasectomized, ovary-sparing spayed, or OSS, every category side by side. This pattern held up almost boringly consistent. The longer a dog kept its hormones, the fewer problems it had. Let me take a second to repeat that. The longer a dog kept its hormones, the fewer problems it had. And we're talking orthopedic issues, weight gain, general health, behavior, those things across the board. Here's the discovery that stuck with me. Neutered males and spayed females had more orthopedic problems than intact dogs or dogs with gonad-sparing surgeries. That translates into joint problems showing up more and more in dogs who lost their hormones the earliest. Intact males actually had lower cancer rates than neutered males. But get this, dogs who kept their hormones longer, even the ones that were eventually neutered, got diagnosed with cancer later in life than dogs who lost their hormones early. That's huge. We'll come back to that later in the series. One more thing we're flagging. The vasectomy and ovary sparing, or OSS, groups in this study were small, under about 200 dogs each, compared to over 1,000 in the traditional groups. It's not a study flaw. It just reflects how few vets have been doing these procedures. But it means those specific numbers deserve a little humility. The pattern held anyway. Hormones are not just about reproduction. They're doing more work in the body than most of us were ever taught to appreciate. Jet's story. I want to tell you about my dog, Jet. He's thing one in my household, and we got him in 2020. I love that dog to pieces. I wasn't planning on neutering him at all. Then my husband wanted thing two because he thought Jet needed a friend. We'd already talked about gonad-sparing options early on, but when the litter came and it turned out to be all males, woof, that decision got made for us before we even had a chance to make it. Because I'm going to tell you something. Put two male Jack Russell Terriers together, it becomes P-Fest, my friend. Here's what I knew going in. Jet already had some knee issues, patellar luxation. His kneecaps didn't track quite right. Common enough, and I wasn't really panicked about it. I knew there'd be an impact from losing his hormones. I wasn't naive about that. I just thought I had enough tools, enough knowledge to offset it. I was wrong about how much it would take. After his neuter, he lost muscle mass fast. Once that muscle support was gone, the knee that had been manageable stopped being manageable. He ended up needing surgery. And the surgery itself kicked off its own chain reaction along with some underlying vaccinosis, and it morphed into skin allergies that he's still managing today. Talk about domino effect. Hindsight is a strange thing to sit with, though. If I'd known then what I know now, I think I would have made a different call for Jet specifically. Not because the decision was reckless, we thought it through, but because I didn't have the information I have now. Nobody handed me the piece about muscle loss and joint compensation. I didn't have it, so I couldn't weigh it. Jet's the reason I started down the hormone replacement path in the first place. He's my practice muse. And if I'm being totally honest, maybe my own hormonal changes as I've aged had something to do with it too. That's really what this episode is about. Not telling you what to choose, just making sure that you get to choose with more than I had. What's actually behind door number 3? You already know what's behind door number 1, spay or neuter, the standard, the expected. Door number 2, staying intact, comes with its own real risks for your dog that ages. For females, pyometra, a uterine infection, becomes a genuine threat. For males, prostatic cancer becomes a possibility. Not a guarantee, but a real possibility. So what's actually behind door number 3? For a female, it's ovary-sparing spay, or OSS. The uterus comes out, so no pregnancy risk and no pyometra risk. But the ovaries stay, which means the hormones stay. The incision itself is a little bit larger than a traditional spay since we're accessing and removing the uterus while also leaving the ovaries intact. But the healing process afterwards looks basically the same. She'll still cycle, hormonally speaking, though with little to no bleeding. She definitely will have some swelling of her vulva, and she will draw attention from intact males nearby whenever she's in heat. And here's something worth knowing up front. We usually recommend letting her go through 2 heat cycles before deciding if this is the permanent path. Because if you change your mind later and want the ovaries out too, that's a much harder surgery once the uterus is already gone. So it's worth being sure before you commit. For a male, it's a vasectomy. The plumbing gets interrupted, but the testicles stay exactly where they are. No reproduction. full hormone potential uninterrupted. It's actually a simpler surgery than a traditional neuter with less recovery time. The difference owners notice in the healing, it's in the months and years after watching their dog stay fully hormonally himself. That's really the spectrum across all three doors. One that removes reproduction and the hormone, one that removes reproduction and keeps the hormone, one that touches neither. You always had three doors. Most of us didn't get shown this third one. What the door actually asks of you. I don't want anybody walking away from this thinking that door number 3 is the harder, riskier choice. It's not. The benefits, joint health, muscle maintenance, lower rate of general health problems, and a longer runway before hormone-related decline are real. And for most households, they outweigh the extra vigilance by a lot. The real question isn't whether this is a good idea, it's whether you have the bandwidth. Think of it like matching a breed to your family. A couch potato household and a Belgian Malinois aren't really a good fit. Not because the Malinois is a bad dog, but because it needs a life you're not set up to give it. Flip it around, and a high-energy family with a Basset Hound ends up frustrated too. That dog just can't keep up with the pace that the family needs. Same principle here. Plenty of my clients and friends manage OSS and vasectomy seamlessly. Their dogs are living markedly healthier lives for it. They just show up and participate a little more. And if you've ever sat with a dog through a cancer or other chronic disease diagnosis, really sat with them, the whole agonizing arc of it, you already know you'd do almost anything to stave that off for the next one. A little extra vigilance starts to look like nothing at all. The field's catching up, too. In 2025, the WSAVA, the International Vet Association that sets global guidelines, put out new recommendations moving exactly in this direction with regards to spay and neuter. Case by case, not one size fits all. Bottom line, this was never actually a yes or no question. As a pet parent, you always had 3 options for your pet. Most of us just never got shown door number 3. If you're a new puppy parent, ask your vet about all 3 doors for your dog specifically, not just the 2 you heard of. If your vet's never talked through OSS, vasectomy, or staying intact with you, or doesn't even know what they are, consider a second opinion. Not because door number 3 is automatically right for your household, but because you deserve to actually choose instead of just defaulting. Next episode, we're going to go deeper. We're going to talk about what these hormones are actually doing in the body and why losing them changes more than reproduction. We'll also talk about why it hits muscle, joints, and even mood. I'm going to walk you through the science, and then I'm going to get personal about it too. Before you walk into the next appointment, grab this episode's pocket guide. It's not a recap. It's the questions I actually want you asking before anyone picks a door for your dog. This is Dr. Pam. Thanks for listening. We'll see you next time.